Hello, I'm Reggie Elam and I'm an advanced practice registered nurse.
Hi, I'm Pat Coyne. I'm an advanced practice registered nurse.
Hi, I'm Jessica Jordan and I'm an advanced practice registered nurse.
Hello, I'm Kevin Briggle. I'm an advanced practice registered nurse.
Rethink, the advanced practice registered nurse. In healthcare settings throughout the Commonwealth of Virginia, advanced practice registered nurses, or APRNs, are playing a major role in the way quality healthcare is being delivered. But today, there's a new focus on the horizon for the advanced nurse practicing in the Commonwealth of Virginia. Recently, the Virginia Action Coalition, a group formed by the Robert Wood Johnson Foundation and the AARP Foundation, was created to implement solutions to the challenges facing the nursing profession and to transform the way Americans receive health care. Backing the formation of the coalition was a major national study conducted by the Institute of Medicine, or IOM, which focused on the future of nursing. The report was based on the research process and provides objective findings, conclusions, and recommendations based on the available scientific evidence. Today, the core focus of the Virginia Action Coalition is that advanced practice registered nurses should practice to the full extent of their education and training.
The Institute of Medicine report was released in 2010 in October, and then in November they had a national summit where about 250 leaders across the nation came together. I had the privilege of attending that meeting, and at that meeting the president and CEO of the Robert Wood Johnson Foundation spoke, and she made a very, very, very clear message to us that this IOM report should not sit on a shelf, that we should implement these recommendations.
With more than 267,000 advanced practice registered nurses in the U.S. and more than 7,000 in Virginia, APRNs represent a powerful force in the healthcare system. The National Council of State Boards of Nursing has created a long list of regulatory requirements that each advanced practice registered nurse must comply with under a model known as the APRN consensus model. There are many requirements under the consensus model, including completing accredited graduate-level programs, passing national certification exams, and acquiring advanced clinical knowledge and skills, preparing them to provide direct care to patients. Finally, APRNs practice in one of four roles, which include Certified Registered Nurse Anesthetist, CRNAs, Certified Nurse Midwives, or CNMs, Clinical Nurse Specialist, also known as CNSs, and the Nurse Practitioner, or NP.
The advanced practice nurse role is really a critical role to patient care. It takes a team of individuals to really care for patients effectively, and the advanced practice nurse has been trained his or her entire life in patient care and patient focus.
With the background of the APRN in place, let's take a closer look at each of the APRN roles, starting with the Certified Registered Nurse Anesthetist, or CRNAs.
CRNAs are advanced practice registered nurses who play a vital role in the Commonwealth of Virginia by providing anesthesia services in a wide variety of healthcare settings. We provide safe and competent anesthesia care in hospitals, physician's office, dentist office, and ambulatory surgery centers. CRNAs have extensive critical care nursing background before they enter their master's degree program in nurse anesthesia. Once they complete the rigorous master's degree education, then they must successfully pass a national board certification exam in anesthesia. When they pass that national board certification exam, then they are allowed to practice as CRNAs.
Certified Nurse Midwives, or CNMs.
Nurse midwives in the state of Virginia are a diverse group. Nurse midwives can work in many settings, including hospitals, medical clinics, and in private practice. Nurse midwives often deliver in hospitals, they can deliver in birth centers, and even at homes. There are many misconceptions regarding nurse midwives. In particular, people believe that nurse midwives only deliver babies outside of the hospital in home settings. One of the things that they don't know about nurse midwives is that we really provide care throughout the continuum of life. So midwives can provide care from adolescence through menopause.
Clinical Nurse Specialist, also known as CNSs.
A clinical nurse specialist has been educated in a master's program to be a clinical expert in an area of nursing practice. First and foremost, we are direct providers of care at an expert level, but we also coach and educate other nurses on how to do that care as well. One of the primary things that a clinical nurse specialist does is know the research related to the population that she serves or he serves. And you want to be able to bring the evidence from research to the patient. And that's what clinical nurse specialists do.
Nurse practitioner, or NP.
Nurse practitioners, we are advanced practice registered nurses, and we have completed a graduate level education in either a master's or a doctorate degree. Nurse practitioners hold a national board certification in their area of specialty, including family, pediatric, geriatric, adult, and acute care. Our core philosophy is individualized focused care. We not only pay attention to the condition, but also its effects on the patient and their families. Nurse practitioners emphasize on prevention, wellness, and patient education. In addition to healthcare duties, we conduct research and also often involved in patient advocate activities.
The advanced practice registered nurse is already making an impact on the delivery of quality care in Virginia. But today's focus on the profession by the Virginia Action Coalition, with support from the Robert Wood Johnson Foundation and AARP, is empowering the advanced practice registered nurse to fill the gaps of care in multiple settings, provide care in rural areas where it can't be provided, and allow these professionals to practice to the full extent of their education and training.
AARP wants its members to have high-quality health care. Safe, affordable, accessible, and advanced practice registered nurses are a huge part of that effort. So through the Virginia Action Coalition and AARP and Robert Wood Johnson Foundation, we're focusing on the profession. When they can practice to the full extent of their education and training, consumers win. High quality, cost-effective health care. That's what AARP wants for its members.
It's time for us all to rethink the advanced practice registered nurse.